exciting conversation today on the benefits of psychedelic-assisted therapy in a clinical or controlled setting is Ronan Levy. You've seen his face before, co-founder and executive chairman of Field Trip Health. And in favor of an immersive experience, one might even call an extended therapeutic experience or model in the form of psychedelic retreats, is Dr. Mike Hart, an expert on plant-based medicine. Thank you both for being here. I want to start off by talking a little bit about the type of person that we are talking about when we kind of divide up the extended therapeutic model with these retreats versus a clinical or controlled setting. So Mike, can you start us off by talking about what that person looks like? Or is it really coming down to a matter of access at this point?
Sure. Again, thanks so much for having me on, Nicole. I really do appreciate it, and happy to talk about this subject today. But I do feel that both options should be offered to people, and the reason why I feel that is because I feel like there's a certain subset of patients that I'm going to discuss that I think would benefit more from going to a retreat, and there's probably a certain subset of patients that would benefit more from going to a clinical setting. So in my opinion, a lot of this comes down to just like personality type. So there's some people who they really want everything kind of done by the book. They want all of their I's and T's crossed and dotted, and they want to make sure that they're doing something not necessarily in the most efficacious possible. It's something that's been studied and researched the most, and they feel comfortable. People who are dressed professionally in a professional setting, going to a medical center, recognizing that there's lots of medical patients that are coming into that center, and that kind of makes them feel comfortable because they feel like they're in a valid medical center, and they're seeing a physician who does not only just prescribes psychedelics, but other medicines as well. And I think there's a lot of validity to that, and I understand those types of people. But there's also another subset of people that I'd like to talk about, and I don't feel that they do feel comfortable in those types of settings. There are people that would rather do the medicine in nature. They feel like they would rather connect with nature, connect with their surroundings, and they don't feel that they need to be in a medical center in order to get benefit from the medicine. They feel that they can get the same experience and the same benefit from just going to a retreat with someone and experiencing that effect in nature. And I know that we don't have any randomized controlled trials now that looking at the efficacy of one versus the other. But I do feel that there's a lot of people who would benefit from that type of retreat. And again, there's going to be people who would not benefit from that retreat. The first group of patients, because they're not going to feel comfortable seeing someone, in sort of like white pants, so to speak, and with like, braids on and or with dreadlocks, they just don't feel comfortable, in that type of setting. So I understand, that group of people, and I do feel that, the clinical setting should be there for those groups of people. So, that's sort of my whole point, and that's why I really liked what you said last time, Nicole, in your interview. And I do feel that, there should be an option for both groups of people.
Okay. So Ronan, do you want to comment on the white pants and dreads versus suit and tie model?
I mean, I was just going to say that I wish I could grow dreads these days, but listen, I think Mike's point is perfectly valid, which is, it comes down to preference, and we know that context and experience matters in psychedelic settings. So there's a number of different ways. And like most things in our society, we like to make everything binary. Either this one's for you or this one's for you. It's like they're both for you, and it depends on circumstances, or neither of them for you, or one's for you, or the other one's for you. But Mike's point is right. Expectations matter, context matter, preparation, mindset, all of that matters in the evidence around psychedelic therapies. So if you don't feel comfortable flying to Peru and hanging out with a shaman in the jungle for a week doing ayahuasca, then you're probably setting yourself up for at least increasing the likelihood of a bad experience. I'm not going to say you're setting yourself up for a bad experience. Same token, if you feel really uncomfortable around doctors, I know I get white coat syndrome and like my blood pressure goes up, even though I generally speaking like doctors, you can also set yourself up for a potentially negative experience. So both have relevance, both have application. And both have relevance and applications depending on where you are in your journey. Certainly, if you're a more extreme case, suffering through extreme treatment-resistant depression and other experiences, then, my default is like go with what's a little bit more scientific, at least as a starting point, because it is going to be more controlled. You're just going to have a little bit more certainty that the circumstances can be contained effectively and mitigate downside risks. But if you're, I think, like most of the people who are exploring psychedelic therapies who are dealing with differing degrees of depression or mental health conditions, it's where you are. Maybe you don't have the finances to fly away for a week, or maybe, you don't want to do it in a doctor's setting. At the same token, I think the other thing to keep in mind is it depends on how it fits into your life, right? It's nice to take a vacation and go to the islands for a week of relaxation, but 2 hours at a spa also can create significant therapeutic impact. So the one thing that's nice about a more clinical setting is it can be more integrated into a day-to-day life, even if it's not as an immersive experience as going away to a retreat.
Yeah, you touched on a few interesting points, and a few things I came across as well after my interview with Dr. Jesse Hanson was that these retreat centers are being called transformative vacations. So, much like going on a vacation, someone might experience something akin to freedom or a break from their life. And I think we've all experienced this, where we come back from a vacation and that slowness, and we're like, how did we manage to do so much before? Who was that freak of nature that I was a week ago?
And how quickly you slip back into old routines, right?
Absolutely. So I do want to touch on integration, because something interesting that he had said was that experiencing a deep or profound psychedelic experience, having an experience like that, and then being thrust back into a city right after you walk out the door, or even something like driving a car, could be quite jarring for people. So how is the clinical or controlled setting allowing for possibilities of integration?
I mean, it's sort of, sorry, you can go ahead and answer that, Ronan, but I was just going to say, that's sort of the reason why I wanted to chat today, mostly just because I do feel that, integration part is key. And I do feel that there's a lot of, advantages for the, for doing it at a retreat versus, say, doing it in a clinical setting. But you can also make, an argument that there are some advantages in the clinical setting, but I kind of jumped in there. So Ronan, go ahead.
No, that's okay. The truth is we do make an effort to ensure integration as a part of the experience in a clinical setting. Right now with our Field Trip Health Centers in North America, typically most people do two ketamine sessions spaced out over a couple of days. And then within a couple of days, we do a pure integration therapy session using more conventional cognitive behavioral technique considerations. But you're right, when you walk out the door, I mean, within Field Trip, we invite people to stay as long as they need to, within reason, to make sure that transition is something that's a little bit more manageable and less jarring. But I think it's also important to keep in mind that even if you do go away for a week and have a very transformative experience, getting off that plane, in the winter in Toronto, it's going to be jarring, probably more jarring in many respects, because you've diverted so much from your routine that integrating back into your normal life is going to be jarring as well. So I think it's just that the nature of transformative experiences is that there's always going to be some sort of reconciliation. What is nice about the clinical model, and being founded in kind of urban environments or our normal Western North American lifestyle, is that you have probably greater access to resources to continue the work. So even though it's maybe a little bit of a bumpy integration because you don't have that length and depth of integration that you get at a retreat, you do have that continuity of care. And I'm not speaking for all retreats because I don't know, but I think that's one of probably the bigger challenges with retreat models is it's more episodic, and therefore the continuity of care is less well established.
Yeah, what I would say on that is that, like, when you have these experiences in retreat, and say if you have, 2 or 3 days, and you should have 2 or 3 days, after, you have your first experience, whether it's a clinical setting or in the retreat setting, you're less likely to encounter things that may take you out of that mindset. And I think that, like you did make a really good point, Ronan, that like, you're doing this so that you can go, back into the world and be a happier person. You're not doing it so that, you can just go, live off in the woods, and, that's not what this medicine is for.
Honest, we all want to do that. Like we all do want to be able to just fuck off and go live in the woods. No,
we do to some degree, but at the same time too, like we're doing this medicine, it's not so that we can do that, go fuck off and live in the woods. We're doing that so that we can come back to our work and come back stronger and kind of like, not feel stress during, times that, were previously making us stress. And that's when I feel that you really know that the medicine is working. It's like, hey, like, a month ago, if I had been in this situation, I would have been like super stressed because, I have, all this work to do. I have all these bills to pay. I have all these people to see. But for whatever reason, I'm still not stressed. Like I'm still doing good. It's like, to me, that person has healed a lot more than someone who has just said like, okay, fuck it, I'm just gonna like screw everything and like, not pay attention to anything, not take on any responsibility, and just kind of, leave my life so to speak. So, I think the person that can integrate is much more healed. But, just coming back to like the setting, after you finish your dose, the reason why I sort of like the retreat model, I don't want to say more, but, what reason why it may have more advantages is because I do think you do need that sort of feeling to like permeate in your body for 2 to 3 days afterwards. Meaning like after you have this like beautiful experience, it can, I think, get sort of like crushed or nullified if you do, go right back into the city, you start driving a car and all these things kind of start happening, and it can interfere with your mindset as well. And then right away you can be like, oh, well, like, I guess that stuff like doesn't work, whereas if you do it in more of a psychedelic retreat setting, I think that like, if you're not having any low stress for like, you're having, low stress days for a few days because you're away on retreat on a lake or whatever it is, then those feelings are going to like permeate more, and it's going to like, like delve deeper into your mindset. And I think it's going to break up that default mode network even more. Like I don't think that, it's going to be, I think that it's less effective if you go right back into the city. I think that, you need a few days for that medicine to permeate. But then I would say after that, like to Ronan's point, like say if you did go to Peru and do that, yes, like when you get off the plane, then, especially if you're doing it in February and you get off the plane in Toronto, it's gonna be, very, very cold. And you got to realize like, okay, like, I let those feelings, permeate for 2 or 3 days, but like now it's time to get back to work. So I feel again that like, there's benefits to both ways of doing it, but I would really strongly advise, not to go back into work for 2 to 3 days, but at the same time, measure the effectiveness of the medicine by, can you go back into the life that you had previously before and still be functioning, maybe even at a higher level, the same level, with less stress and with just a better overall sense of well-being.
I just want to pick up on that because I think it's an incredibly important point that people aren't talking about in this entire conversation around psychedelics and mental health. Because Mike, you touched on the point that you actually said the word responsibility at one point, and you defined responsibility as like that onus of like everyday life. But I like to think about the word responsibility as like the roots of its word, which is the ability to respond, right? And this is really important because everyone thinks it's the medicine and it's the experience, which are important. But I think what we're really talking about here is learning the skill set to actually be responsible, actually having the ability to respond, right? And what that means is that certainly if you spend a week at a retreat and let it, really sink in, there's going to be a level of depth that it reaches that you're not going to get in an episodic experience when you're going from normal life into the clinic and back. No doubt about it. But I think the real skill set that everyone should be looking for is how do you tap back into that resonance? How do you tap back into that energy so you don't need the medicine? So you can be like, oh yeah, I remember what it was like when I sat in the retreat for a week and resonated on whatever kind of peaceful wavelengths, however you want to describe it. Can I bring that back? Can I respond to my circumstances here and now and bring that back? Those are the really important considerations that I think people need to be thinking about. So we're not necessarily deferring our autonomy and our agency to, oh, it was the medicine and the experience. It was actually the medicine and experience showed me a path. And now it's on myself to learn how to get back into that path. And I think both are equal ways to get there. They just have different advantages and disadvantages. But, I really think we need to shift the conversation to being like, what is the purpose of this all? And the purpose of this all is actually giving people skills that they don't have right now or have lost, which is to find that peace, that serenity, that mental well-being, however you want to define it.
Yeah, I think that's an important point, is that the medicine doesn't do all the work. And Nicole, jump in anytime if we're kind of late for time here. But
yeah, I forgot that both of you can just talk forever. So my bad for choosing you both.
well, we can definitely do it again. But my point was that if you have a bacterial infection, the antibiotic does all the work. You don't have to work with the medicine. That's just going to go in, kill the bacteria, and clear up your infection. You're done. That's not the same with mental health, and they've tried to do that, I think, with antidepressants for the most part. And when I say antidepressants, I'm really referring to SSRI, selective serotonin reuptake inhibitors. But with psychedelic, that's just not the way that medicine works. You do have to work with the medicine. You can't just expect the medicine to do all the work. So, I completely agree with Ronan on that point, and that, we do need to maybe focus more on the integration part, because, I do feel that there's some people out there who feel that, they're just going to take, 5 grams or 6 grams of mushrooms one night, and the next day all the problems are going to be, solved. And that's just, not true. And we do need to change that narrative. So very good point, Ronan.
Yeah, and part of that too is a reminder. Some of the people that I've spoken with, taking 5 grams of mushrooms, sometimes it's just the fact that they can feel something at all, and that they're reminded of the compassion that lies underneath the shame that they've been feeling, or the hardening of their heart. Sometimes that is just like an ice pick that's able to break through. Of course, there is work that needs to be done after. And when you look at something like a retreat model, you do have programs that are built around and into the week that expose people to new things that maybe they wouldn't have tried before, such as certain foods, or even something like yoga or certain activities. Whereas in the clinical model, they are, and Ronan, correct me if I'm wrong, but released back into their life, and it's not necessarily like a holistic approach. Let me know if that's accurate or not.
I mean, to degrees it's accurate, but it's not like we send people back into the wild. We've established very deep relationships with them and continue to support them. So we encourage people to actively engage in meditation programs and yoga programs and art therapy programs. And we're just in the process of launching what we call and beyond therapy. So once you've completed sort of an initial program, there's going to be these regular touch points. So you can continue to maintain and continue to engage and be encouraged to explore new opportunities, new experiences, and all that kind of stuff. Because at the end of the day, it all comes back to the point that this is really about fundamentally responsibility and lifestyle change, and supporting yourselves accordingly.
I think Nicole made a really good point though too. I think some people, they just need to feel differently than they do right now. And, when you take, a high dose of mushrooms or even a low dose of mushrooms, you're going to feel different, and that's going to evoke quite a bit of change in your mind. And you're going to have to start, asking yourself some questions. And another point, Nicole made is it just reminds them of oh my God, I can feel empathetic. And then they may, think back of, 5 or 10 years ago when they were more of an empathetic person, and then and the other thing too is that they should feel that shame and guilt. You know, I don't want to go on too much here, but like, you know, with regards, like there's, you know, something that we always ask in medicine about, you know, when someone's depressed, is this famous, you know, Siggy Caps thing, and where there's a bunch of different questions, and the G is stands for guilt. You know, do you feel guilty? And you know, if you did something shitty to someone and you don't feel guilty, like you're a psychopath, you know? And second of all, like, you know, if you did something wrong and you feel guilty, like that's there so you don't do that again, you know? So like guilt isn't always necessarily like a bad thing. And, you know, if you do feel shame or guilt, you know, when you're having these experiences, you know, I believe, you know, I know this sounds a little bit cliche, but that is, you know, the ego dissolving, and you should feel those feelings. And I do think that that's why, you know, when that it creates those feelings of empathy, because you feel that shame and you feel that guilt. So, you know, I just wanted to make that point, just because we were chatting about guilt, and sometimes it sort of gets left out of the conversation in mental health.
Let's aim to wrap up within the next 2 minutes here, but I just want to touch on, is there anything that's currently missing from the model that you are each advocating for, if we are to put it in the binary? Ronan more with the controlled setting, and Mike, for the case of this discussion, more in the retreat model. Is there anything that's missing there? And then in that, a closing statement from you in whatever you feel has been lacking in this discussion up until now.
Yeah, I mean, I think we've sort of touched on, I think both have their benefits and limitations, and then they both have their purposes and time and place. You know, could there be a hybrid model? Sure. You know, that's definitely a possibility. And I think people need to work to innovate that. But I think both provide a great foundation. And the fact that we're talking about this at all here in 2021, I think is a marvelous achievement, because 10 years ago, this would have been a conversation in the first place. So as much as there's still room to go, we need to appreciate exactly where we've come. And, you know, I think we've got the foundation for something that's going to help a lot of people. So it's an exciting time to be part of this.
Yeah, and you know, I think a hybrid model is something that, you know, could be done. And just, you know, to that effect, like I mentioned earlier about like in the retreat, how often, you know, you're met with some, you know, dude with like, again, I'm nothing against, you know, this type of like appearance, but like, you know, a dude with dreadlocks and white pants and maybe has, you know, like half his teeth kind of thing. Like why can't you, you know, go there and also meet, you know, a doctor who looks like he really takes care of himself, you know, is really fit and really good shape, you know, obviously, you know, does all the things.
I'm sorry, talking about yourself right now, that was a little on the nose.
Well, you know, I'm not saying that I couldn't do that, but, you know, I do feel that I am in the position to do that. But I do feel strongly that, like, you know, there's people who just don't want to go to those retreats because when they meet someone like that, they're not there. But like, I know it, like a lot of people that I know, like professionals, like they just want to see a professional looking person. And yeah, I guess I plugged myself a little bit there, but that's all I can really do for now. What's been said is said. So that's it.
Forever.
It's going to be on the internet forever.
Thank you both so much. Appreciate talking to you.
Okay, thank you, Nicole. Really appreciate it.